Hello, everyone, and welcome to Heads Up, the official weekly podcast of the National Headache Foundation. This is Dr. Lindsay Weitzel. I'm a migraine strategist. I am the founder of the Facebook group Migraine Nation, and I'm a chronic daily migraine survivor. I am here today with a very special guest that I think everyone is going to enjoy. This is Dr. Gretchen Tietjen, MD. She is a professor emerita at the University of Toledo. Hello, Dr. Tietjen.
Hello, it's nice to be with you today.
Thank you for being here. She has published extensively in the area of childhood trauma, childhood abuse, and future development of headache disorders and migraine. And that is what we're going to talk about today. So we are very excited to bring this information to you. This is a very interesting association that clearly does not apply to everyone, but applies to a great number of people in our community, and we'd like to delve into it today. Well, first let's talk about the prevalence of abuse and whether it's really in our community of people with headache disorders, and whether it's really just childhood abuse or is it stress? What is it that we're talking about here that is sort of associated with our illness?
Okay, so, well, a lot of the research that I had done was on sort of what I like to refer to as early life stress in persons, and what are the health effects that they have later in childhood or adolescence, but also into adulthood.
Right.
And so some of the papers that I've done have been specifically on things that would be considered maltreatment. So that would be abuse, such as physical, sexual, or emotional abuse, or neglect, such as physical or emotional neglect. But it could also be things in the household that were maybe dysfunctional, such as having a parent that abused drugs or alcohol, a parent that had been incarcerated, a parent that had abandoned a child that's witnessed domestic violence. So those type of things, all those things, or we found that all those things were associated with having frequent headaches in adulthood.
Do we have numbers on the rate of these adverse childhood experiences in people with headache disorders or migraine? How much more prevalent is it in our community?
From anywhere from 50% to 60% to 70% of people will say that they've experienced one of these. So I had looked at that with Dr. Richard Lipton and Dr. Don Buse several years ago from a study called the American Migraine Prevalence and Prevention Study. And the only people in the study we had were people that experienced episodes of tension type headache, which is pretty common in the population. Probably 70% or more people experienced that, versus people that had migraine headache. And a small number, 5% about, had chronic migraine. The rest were episodic migraine. And it did look like, if we compared those two, that people, at least those with that had experienced emotional abuse, were about 60% more likely to get migraine.
You looked at physical abuse, sexual abuse, and emotional abuse, and also neglect, and it is definitely the emotional abuse that stands out as being associated with development of migraine. Am I correct?
So we looked at emotional abuse and sexual abuse and emotional neglect, and we really found it was emotional abuse that seemed to make the most difference, which was interesting, because in our clinic study, when we were comparing episodic to chronic, we also found that it was really emotional abuse that stood out as the one that seemed to have the closer association. And we did do one more study from a database of people that had been followed from adolescence all the way through adulthood. And the people in adulthood, they were young adults, 24 to 30, 2 years old, when they were asked about headache and asked about their childhood specifically. And in that population, we found again that it was really, when we controlled for all the other factors, it was really emotional abuse that made them more likely to have it than the general population of people without headache.
So when you say controlled for people who aren't used to hearing someone talked about statistics. It means that regardless of whether or not they had anxiety or depression or their age, etc. So that means you controlled for it. Doesn't matter about those things. They were more likely to develop migraine if they had emotional abuse.
Yes.
Okay. And they were nearly twice as likely as the general population, correct?
Yeah, I think in that study it was about 50 to 60% more likely to develop it than the general population. There's ways that you can look at a person's health and you can sort of figure out, if somebody comes in and they don't just have migraine, right. Let's say they have migraine and a bunch of different other pain conditions, as some people do, like fibromyalgia or irritable bowel or some of those. The possibility, the more of those pain conditions you have, the higher the possibility that you have that you've had an adverse childhood experience.
Right. And so I think that's an interesting point. Yeah. And I think doesn't it go the other way, that the more adverse childhood experiences you have, the more likely it is that you have a pain condition. Am I correct?
That is correct. So it's really both things tend to do it. So when you look at the actual abuse, the more types of abuse you have, the more likely you are to have a pain condition or any health condition that's been associated with that. It depends on the severity of the abuse. It depends on when it happened, and it's not just any one time. There's several critical periods, and they're different for for the different sexes. Boys and girls are different as to when they're most vulnerable to there being changes in their physiology that are going to make them more likely to develop a certain condition. It also makes a difference as to what gender the person is, but just because of these different periods. And also it makes a difference as to, what their family response was to the abuse. I mean, was it someone in the family committing the abuse, or was it there was somebody there to help them, or, either a parent or grandparent or someone that they were close to help them, deal with it? That made a big difference in what health effects it.
Yeah, just like one person for them to depend on who was a strong connection for them. I think that was very heartwarming, because I heard that in one of your talks too, was very helpful in the outcome for the person. I think that's a good thing to get across.
Yeah.
Really quick, we keep talking about the emotional abuse is the most important type of abuse when it comes to developing a pain condition. Can you tell us what emotional abuse is? I think maybe not everyone knows what we're talking about.
Yeah. So sometimes it's referred to as psychological abuse, but I'd say a lot of it is something where a person is sort of, especially in a mean-spirited way, but someone being very critical of them, belittling them, humiliating them, making them fearful that something physical is going to happen to them.
Can you quickly kind of summarize some of the hypotheses on why childhood abuse might lead to a headache disorder? What is it doing in our bodies?
Yeah. So you can kind of look at a bunch of different systems, and it affects those. So it affects the brain. It affects the brain structure. The brain doesn't develop exactly the same way, and there's certain areas of the brain that are much more vulnerable to getting affected. One's called the hippocampus, but there's other parts of the brain as well. A lot of those that sort of deal with how you process emotion and how you process pain, and maybe that's in part why people are more prone to getting painful conditions when they've been abused. But there's and also we found in animal model that the occipital cortex, where a lot of aura forms, that it made the brain sort of hyperexcitable in some areas. But also the immune system, how you deal with disease and inflammation. That one has really been a big target of early life stress. So people are more likely to have conditions associated with inflammation. That might be coronary artery disease, it might be stroke, it might be arthritis, and other, pain conditions. And migraine is certainly one where there's thought that there's some increased amount of inflammation.
Right.
It also affects the sympathetic nervous system, or what we might call the automatic or autonomic nervous system, and the parasympathetic nervous system. So it might, have an effect on how the body functions in general, whether your heart rate goes really up high when you get it, or if you feel sick or faint, or, those type of things. There are abdominal, a lot of the, pain that a person might have abdominally might be from the influence on the parasympathetic nervous system, or the sympathetic nervous system. And those are all affected by it. The endocrine system, which might affect the hypothalamus, pituitary, adrenal axis, like you might release a lot of cortisol, which is sort of a stress hormone. And, that can have a bad effect over time. If you're
Right. Well, my next question, I think, might be one of the most important questions that we asked today, which is, so we know this association exists, but let's make sure that we talk to people about some of the stuff that has been shown to help. If this is a problem that has occurred for people, if it is true for some people in the community, what are some of the things that have been shown to help in this area?
Yeah. So, when it comes to, is there a different way, for instance, to treat migraine if a person has this history or not?
Mm-hmm.
It's not one that we really know the answer to that for sure, because no one's really looked at it in quite that way. But if you look at some of the drugs that are used to treat migraine, that may also reverse some of the changes that the person's body experiences. When a person goes through something that's very stressful, some of their genes, it doesn't change your genes, but some of them get upregulated, some of them get downregulated. You have different responses in your body. That's sometimes referred to the epigenome. So it's not a change in your genetics per se, but it's a change in, what sort of turned on and what sort of turned off.
It's a change in the expression of your gene.
The expression of the gene. And so certain drugs that are actually interestingly commonly used in migraine, we think that they're working through different mechanisms, but maybe there's more than one mechanism by which they're effective as preventive therapy. But they actually reverse some of the epigenetic changes, the changes in gene expression that come as a result of abuse. So you can imagine that maybe if a person has been abused, maybe they would respond well to at least short-term treatment with Depakote, or with topiramate, or Topamax, Trokendi. Other things, though, too, that are not drug-related are things like changes in diet, things like with high omega-3 fatty acids and low omega-6, that is sort of an anti-inflammatory diet that has been shown in some people with migraine. Since we know stress increases the inflammation, maybe that would be particularly helpful in this group of people. We know that cognitive behavioral therapy is effective in migraine, but there are some that are trauma-focused cognitive behavioral therapy that might be particularly helpful in someone that has had abuse or maltreatment, that hasn't really had it, or any adverse experience, that hasn't really had it totally processed. Some people will end up in therapy, but some people just don't seek it out. Some of the other therapies, such as meditation, yoga, mindfulness therapies, those might be particularly helpful in this group of persons as well. And exercise. We know that exercise can reverse some of the stress-related changes in the hypothalamic, pituitary, adrenal stress axis. So maybe if a person has sort of had their stress axis, totally gone out of whack through all the stress they've experienced, maybe it would help get that under control a little bit better.
As we always say on the podcast, that combating your headache disorder or your migraine disorder is often like putting bricks in a wall. It's not usually one thing that's going to fix you. So these are a number of bricks you can put in your wall that might be particularly helpful if you're someone who experienced a lot of adversity in your childhood. These are particularly good for you. And I would like to say, because we do get a lot of people that ask this question, they're like, I have a 8 out of 10 migraine I'm in 8 out of 10 pain right now. And how am I going to be mindful, meditate, or explore cognitive behavioral therapy? Some of these things like CBT or the mindfulness that we talk about, or the meditation, are best learned when your pain is at a low level. And then you start applying them, and they are sort of a long-term therapy that helps you. They're not something you're going to learn when you're dying of pain. So that's a very important point to throw out there. So Dr. Tietjen, is there anything else you would like to add to our discussion of adverse childhood experiences and development of headache disorders?
I think that when it comes to understanding the mechanism behind the migraine, or maybe what led to it, or maybe, one of these type of things that has had a physiologic response that can actually be maybe reversed in part, that's when we'll really be able to help those people that have had chronic headaches that haven't found the medications to be as effective as they'd like, or at least to add it on as an adjunct therapy.
We hope that everyone enjoyed and learned a lot from today, and join us again next week for Heads Up. And we would like you all to know that the National Headache Foundation does have an 800 number that anyone could call, can ask questions, and that we do our best to get you the resources that you need. So if you have any questions, you can always dial 888-NHF-5552, which is 888-643-5552. So please call us with any questions or problems that you have, and we will do our best to help you. So this is Dr. Weitzel and Dr. Tietjen signing off for this week. Please join us again next week. Bye-bye, everyone.